thank you very much for coming by the booth today to speak about our new partnership, our new integration. I'm personally very, very excited about this partnership in particular. I actually got into healthcare because of some frustrating experiences I had in the industry, particularly around payments. I've been a big fan of what Instument has been doing from the background, so I'm excited that we're finally doing something together and launching a solution with patients. So thank you for coming here. So
thank you.
I know it's hard to hear me in the back, but those of you in the front already know who I am. So my name is Guillaume De Swarek. I'm one of the co-founders and CEO of Well. Again, just as a bit of history, my background is in the consumer space. I started my career at Google, and then my last company that I was acquired by Amazon and powers the Q&A behind Alexa. And I got into healthcare because I'm a patient. We're all patients, and it can be really, really frustrating to deal with the healthcare industry. Specifically around payments, which is why I'm so happy to speak with you today. So Jim, why don't you tell the cameras and the audience a little bit more about yourself?
All right, Guillaume, appreciate it. On behalf of InstaMed, I'm pleased to be here today with you and excited to talk about the new relationship that our two organizations now have in the patient communication space. Again, as you said, my name is Jim Bettendorf. I am a Senior Director of Business Development with InstaMed, and I'm tasked with working with our partners, such as yourself. And I've been with InstaMed for about a year, but I've got a varied background in healthcare as well, having been on the provider side as a lab billing service manager for a national reference laboratory, as well as worked with a couple health plans. And for about 20 years prior to joining InstaMed, I was with several healthcare clearinghouses.
Awesome. I think the next slide has a little bit of information on InstaMed. Obviously, you are a giant in the field, at least in the field of payments. So. Yes. For those of you that aren't familiar, would you mind sharing a bit about your company?
InstaMed's mission is simple. It's to deliver a seamless healthcare opportunity for all stakeholders in this space. That includes consumers, payers, and healthcare providers. And we focus solely on healthcare. So our mission is to stay dedicated to this space and to be able to provide on one platform a solution that meets the highest levels of security and compliance to be able to aid in that endeavor. And lately we've worked with you in building a relationship to manage our payment solution within your patient communication portal. Yeah. And that's what we're here to talk about today.
Yeah, and billing is incredibly complicated. As a patient, you just think, I owe $30, here's my credit card.
Absolutely.
But then there's the whole complexity of the EOB that can be confusing, and then getting the letter in the mail and paying. So I think on the next slide, we have a little diagram of old school, which I think is understated here, in new school. So talk to me about how do payments work today?
Sure.
What's the typical model for a healthcare system?
Well, we're all, as you had mentioned at the outset, we're all consumers of healthcare. So we're very familiar when we've either presented ourselves for treatment or brought our loved ones to a healthcare provider to be treated. Generally, we go in, we update any information that needs to be updated regarding our health plan or changes in our care. And then at check-in, depending on the billing policies of the organization, we may have to pay a copay. Or in some instances, they may wait until we're through with our encounter, and then we'll pay on the back end. But typically, we leave without any payment terms being established for any outstanding balances that are due once the claims have been adjudicated by the health plans. Healthcare providers will typically send a statement to the patient for that outstanding balance. And as you had indicated, 70% of the consumers who receive those statements are confused at what they receive. They don't understand deductibles. They don't understand coinsurance. They don't understand what was denied, what was rejected, and why do I owe this big bucket of money? So it's a very confusing old methodology that's fraught with delays. And as a result of confusion, most individuals don't pay upon first presentment of a statement. They might wait for the second cycle, the third cycle, the final notice.
I'm one of those people that waits for 3. 3 is my magic number.
Yeah.
And to your point, sometimes the statements and the EOBs come from the payer. which is just incredibly confusing to me as a patient because you're trying to navigate this world. And the worst is I was admitted to the ER. So this is how I started the company. I was admitted to the emergency room. And when you go to the hospital, there's a couple different bills you get, right? You're going to get the ambulance. That's a totally different company. You don't know this as a patient.
Right.
Then you might get the anesthesiologist, which again is a separate contracted entity, and then the actual health system. So you think you've paid for it. And then a couple weeks later, you get another bill, and you're like, wait, hold on. I already paid, the $1,000 that I owe. And it just becomes this incredibly frustrating experience. And
absolutely.
I guess what ends up happening today is I end up calling the phone. And I'm not calling InstaMed. I'm typically calling
your healthcare provider or whoever's name is on that statement that you received.
And what do they do at that point?
At that point, they're going to try to describe to you the service that you had because, like you said, if an anesthesiologist was involved, you probably don't remember who it was or that you had one. So they need to fill in the blanks that didn't exist with that hard paper statement that you received. So
that must be pretty expensive when you think about man hours.
Absolutely. There's a lot of time and effort that's involved in communicating the amount that's due to the patient to ensure that they're remitting as soon as possible or clear on what they need to remit. And to your point earlier, in addition to receiving the statements from the provider, they're also probably receiving an explanation of benefits from the health plan. And a lot of times that'll indicate it's not a bill, but people confuse it as a bill along and then try to match it up.
This is not a bill, but here is the bill. It's
and try to match it up with what they received. Absolutely. So now there's a new methodology. If you'd like to discuss that.
Yeah, and I'm so excited about this because we're both patients. We've lived through this. Many of you have lived through this as well. But this concept of I went to see the doctor. I've interacted with the doctor maybe over text message. I was late to my appointment. I got a reminder, and then a couple days after my appointment, maybe a week, I don't know how much the billing process takes behind the scenes, I get a text that says, hi Guillaume, thanks for coming in a few days ago. We ran your coverage. You still owe $30. Would you like to pay? And that's the missing piece for us. I've always wanted to do this. The missing piece is billing is really complicated. And InstaMed is a leader in this space. You've got that process dialed, and we've finally been able to put the two pieces together. I think we have something to demo today. And also a mutual customer to take this live with, hopefully in the coming months, coming weeks.
Absolutely.
Awesome.
So excited for you to be able to show everybody what we've come up with.
So I'd like to introduce Jonathan. So Jonathan Perlin was one of the lead integration engineers on the project. Jonathan's on our engineering team. He was assisted by a few other individuals on our engineering team in building out this integration, which is part of Well's API strategy. And ready to show it?
Yeah, let's do it.
All right.
We're here today to show you how Well can integrate with multiple systems that need to communicate with patients to streamline your health system's communication with those patients through their preferred means. And so we'll meet the patient where they are, whether it be phone, text, email, or another medium. And so the example we're going to show today is an integration with InstaMed. And so what I'm going to have our patient Aaron Rogers do is he's going to text in and he's going to ask about the balance that he has remaining on his bill. He's not really sure why he has a balance outstanding. And so he's going to text into our line to ask for some clarification about why he has that balance outstanding. Now, while he's doing that, I'm going to orient you. What you see on the right side here are some basic patient demographic data, and all that information comes over directly from the EMR to populate into Well. Now you can see that Aaron's texted in, I have a question about my bill, what is it for? And there are two things that we did automatically within the Well application. The first is that we tagged our billing group. And so what that's going to do is alert any user who's a part of that billing group and draw their attention to this patient communication channel. The next thing that's going to happen is that we're going to send a message to Aaron and link him to be able to go to InstaMed and to be able to pay that remaining balance on his bill, which we can see here is $5. Now, Aaron's not really sure why he has this balance, so as someone on the billing team, I'm going to come in and address that question first. So now that I've indicated to Aaron that this is why he has this outstanding balance, Aaron's going to feel a little bit more comfortable about paying that outstanding balance, and all he has to do now is he's going to go ahead and click that link. and that's going to take him directly to the InstaMed site. Now, a couple of key pieces here. What we do when that patient clicks that link is we pass that remaining balance information as well as all the patient demographic information that you see here to InstaMed. And we get that information directly from the EMR. So the flow is from the EMR into Well and then on to InstaMed. And that allows us to make this experience really seamless for the patient, where all they have to do is enter their credit card information, and then they're able to go ahead and pay their bill directly on the InstaMed website with extremely small amounts of manual data entry. And so it really makes this process straightforward for the patient. So now I can see that Aaron has gone ahead and paid his balance. That logs in the channel so that your staff can see it. And what we do then are a couple of things. Aaron is going to get an email from InstaMed that indicates that he paid that $5 balance, and that's his receipt. And from Well, we're actually going to take that balance information and we're going to log it back to the EMR to let the EMR know that Aaron has paid his remaining balance. Now, this is just one example of the integrations that Well can do. We can integrate with different billing vendors, transportation vendors, survey vendors, and more to make sure that any systems within your enterprise can communicate with the patient as needed and really streamline the processes that you have. That's the demo, Guy.
You're the best. I think, we've both been patients, so for me, I just can't wait for my health system to have this, because I'm actually on statement number 2 right now with Sansum Clinic, so by number 3, maybe I'll pay. I think the balance is $30 that I owe. But I'm excited to take this to the wild. You guys have great reach within healthcare. So if you don't mind, let's just go back to the slides. And Jim, I know InstaMed has been around for a while, does business with a fantastic number of clients, so if you wouldn't mind closing out by sharing some of what InstaMed has done and where we're taking things from here.
Yeah, since 2004, InstaMed's been working in the payment processing space, and our network is quite extensive. And as you can see here, we seamlessly move over 70 billion in healthcare payments in this industry. So we definitely have the size and the scope. We're excited to be working with an organization such as Well on this digital revolution that'll help expedite, hopefully, payment processing and payments to healthcare providers going forward, so that you don't get 2 or 3 or a final notice bill before you make a payment, that you'll use the technology that's in your hand. Everybody has the mobile devices these days, and 80% of Americans report being connected on a daily basis. So why not use what's at our disposal, at our fingertips today, to ensure that we can reduce costs, we can increase efficiencies, and help our healthcare providers get paid for the services that they render.
We made a great product. We're really excited to put this out in the wild. Thank you, Jonathan,
Thank you
for facilitating the demo. Thank you, Jim, for being a great partner.
Appreciate it.
We're really excited.
Thank you.